Hi, welcome to the channel Food Nutrition and Healthy Life. Today I am going to talk about an important food material, that is carrot. We'll look into the physical characteristics of carrot, the nutritional value and the health benefits. Carrot is a root vegetable which is commonly used in daily cooking purposes. It is usually orange to red in color, though the color varies from purple, red, orange, yellow and white. Carrots are used in a variety of dishes, salads, desserts, juices, shakes, etc. The scientific name for carrot is Docus carota. Origin of carrot. The carrot plant is native to Europe and Southwest Asia. The plant has its origin in Persia, where it was cultivated for its leaves and seeds. Now more commonly the taproot of the plant is used as food, although the stem and the leaves are also consumed. Carrot crop. The carrot plant is a biennial plant and the plant is cultivated by sowing seeds. After germination, the seedlings show the differentiation between the taproot and the stem. The first leaf appears at about 10 to 15 days after germination. The leaves are alternate and arranged spirally, with the leaf bases sheathing the stem. The bases of the leaves are pushed apart near the taproot as the plant grows. During the first year, the plant produces a large store of food material in the form of sugar and starch in its taproot. This store of food material provides the plant with energy to flower in the second year. The taproots are mostly long and conical. The cylindrical and spherical varieties are also available. Structure of carrot. The length of the taproot ranges from 5 to 50 centimeters and the root diameter ranges from 1 to 10 centimeters. The taproot consists of an outer cortex, the phloem, that is pulpy in nature, and an inner core, which is a xylem, that is slightly hard. Nutritional value of carrot. Raw carrots are composed of 88% water, 9% carbohydrates, 0.9% protein, 2.8% dietary fiber, 1% ash, and 0.2% fat. The dietary fiber in carrot consists of cellulose and small amounts of hemicellulose, lignin, and starch. The sugars present in carrot are sucrose, glucose, and fructose. Health benefits of carrot. Carrots are mostly composed of water and carbohydrates. The carbohydrates present in carrot are the starches and sugar. Carrots are also rich in vitamins, minerals, fibers, and antioxidants. The provitamin A, beta-carotene, is an important antioxidant present in adequate quantities in the orange-colored carrot. The other antioxidants present in carrot are the lutein zeaxanthin, which helps to remove free radicals that may cause cell damage when they accumulate in the body. Prevents vision loss. The provitamin A, beta-carotene that is present in carrot can prevent nyctalopia or night blindness, which is impairment of seeing in the dark or dim light. Dryness of the conjunctiva, known as xerophthalmia, happens due to the lack of vitamin A. White spots are grayish-white plaques or areas of increased thickness in the eye is also caused due to vitamin A deficiency. The beta-carotene is a fat-soluble vitamin and its absorption is enhanced by fat in the diet. Carrots also contain antioxidants such as lutein zeaxanthin that prevents age-related vision loss known as macular degeneration or degeneration of the retina. Prevents cancer. The increasing amounts of free radicals that are formed in the body can cause various types of cancer such as prostate cancer, lung cancer, leukemia, etc. Carotenoids, the antioxidant present in carrots, helps to protect against different types of cancers by destroying the harmful free radicals that are present in the body. Lutein zeaxanthin is another powerful antioxidant that also helps to fight against cancer. Promotes digestive health. Carrot contains good amount of dietary fiber such as cellulose, hemicellulose and lignin, which helps in bowel evacuation and prevents constipation. Control diabetes. Carrot is a low calorie and high fiber diet. It has a low glycemic index. About 10% of carrot is composed of carbohydrate and 50% of it is sugar and 30% is dietary fiber. Consumption of carrot does not considerably increase the blood sugar levels. Regulation of blood pressure. The potassium content in the carrot helps to relax and dilate the blood vessels and thus reduces high blood pressure. High fiber content in the diet helps to reduce the levels of LDL cholesterol that is harmful for the arteries, thereby helps in the prevention of cardiovascular diseases. The antioxidants present in the carrot also helps in maintaining the heart health. Immune functions and healing. Carrot contains vitamin C, which helps in the production of collagen, an important component in connective tissue. Collagen is essential for wound healing and maintaining the structure of the body. Vitamin C also helps the body to fight diseases and assist healing. Vitamin C is an antioxidant that destroys free radicals that are formed in the body. Bone health. Carrots contain vitamin K and small amounts of calcium and phosphorus. The vitamin K, calcium and phosphorus are necessary for the overall bone health and prevents osteoporosis. Vitamin K is needed for the functional activity of osteocalcin, which is a protein that binds to the hydroxyapatite crystals of bone. Carrots are also used as vegetable added to spicy rice and dal, such as fried rice and biryani. Carrots are dehydrated, sliced, and fried to make chips, flakes, and fries. Grated carrots are also used to make carrot cakes and puddings. Carrot is used alone or mixed with other fruits for making sauces, pickles, etc. Carrot, along with other fruits, are blended together to make juices or health drinks. Health concerns in carrot consumption. Excessive and persistent intake of carrot or supplemental use of vitamin A can cause hypervitaminosis A or vitamin A toxicity. In this condition, the skin becomes yellow. It is characterized by symptoms such as anorexia, irritability, headache, drowsiness, vomiting, swelling, peeling of skin, etc. For some people, carrots can cause an allergic reaction, which is similar to that of pollen allergy. Now we'll move on to look at the physical characteristics of a carrot. This is a carrot that we usually use for cooking. It's actually a taproot that is conical in shape. It is broader towards the base or the lower portion of the stem, and it is long and tapered towards the root. This is the root portion. Here is the trunk. This is the place where the stem has been attached. This color, it is usually orange to red in color. Most of the carrots that we receive are orange to red in color. The stem is located just above the ground, and the lower part of the stem is attached to the upper portion of the taproot, which is around here, and it is thicker and there are no lateral roots. The base of the stem is somewhat thicker and it doesn't have any lateral roots. Whereas the entire taproot is elongated and conical, and it is long and tapered. The lower part of the root, which is elongated, and it goes directly beneath the soil. Along the entire part of the taproot, there are certain concentric lines that are growth lines. There are concentric circles. These are the concentric circles or growth circles, which are seen along the entire length of this taproot. You can see the transverse section of carrot. There is a definite distinction between the two layers of the root, that is xylem and the phloem layers, and there is the skin on the surface. There is a very thin layer of skin that is seen on the surface. There is a thin layer of skin which is seen on the surface of this taproot, which usually is scraped off when before cooking. And the next layer is the outer layer consists of the phloem, which is succulent and which is pulpy and succulent, swollen in nature. This is the outer layer, which is swollen in nature. It is covering the inner layer, that is the xylem layer. The xylem layer is directly connected to the root of the it is connected directly to the stem of the plant. The xylem it is continuous to the along the root. The xylem layer it is continuous along the entire length of the root, extending from the lower part of the stem to the tip of the root, extending along the entire root length. So that is the xylem layer, which is a layer that transports all the water and mineral material to the root. So this is a succulent. It's almost a succulent nature. It has a succulent nature, and the inner xylem layer runs the entire length of the root, extending from the lower part of the stem towards the tip of the taproot, and the outer portion is the phloem layer, which is more reddish in color, and so this is how the transverse section of a taproot look like.